everyone, my name is Christina Ramirez and the topic that I will be discussing today is arthritis. I'm going to start off with a question, what is arthritis? Arthritis is a medical condition that deals with the inflammation of the joints. It is not just a single condition, there are many different types of arthritis. It is also a very common disease around the world, with about 46 million U.S. adults having a specific kind of arthritis. There are more than 100 known types of this condition, with some being osteoarthritis, rheumatoid, gout, psoriatic, lupus, and septic arthritis, with osteoarthritis and rheumatoid being the most common around the world. There are about 1.3 million adults in the United States with rheumatoid arthritis, and about 27 million people in the United States having osteoarthritis. As for any type of arthritis, 77 million Americans have been diagnosed. Today, I will be explaining two types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is the wear and tear of the joints. The bones are being separated by cartilage, and around that there is a type of fluid which in this picture is shown with the dark pink color. The cartilage is shown as a layer of white around the edges of the bone. As time goes by, the cartilage gets thinned out, and if it gets thinner faster than the body can repair it, it wears down until there is no more cartilage to help the joints rub smoothly against each other. What happens then is that the actual bones are rubbing against each other, which causes damage because the bones are very hard. The friction that the bones are causing causes the inflammation. Instead of the bone being smooth like it should be, the friction causes them to get rough, and that's what causes the pain. Osteoarthritis results from an overuse of the joints. It can be caused by obesity or participating in demanding sports. Being overweight increases the load of weight on the joints, such as the knee. This extra weight increases strength in the joint and can make the breaking down of the cartilage faster than it would have. Some of the sports that have been known to increase the risk factor of osteoarthritis are soccer, long-distance running, competitive weightlifting, and wrestling. The joints that are most affected by osteoarthritis are the hips, knees, feet, and spine. Some of the symptoms of this condition include deep, aching pain, swelling of joints, loss of motion in the affected body part, difficulty gripping objects, and difficulty when sitting or bending over. The risk factors of osteoarthritis are obesity, gender, and age. Like I mentioned before, extra weight causes more stress on the joints, especially on the knees. Women are also more likely to have this kind of arthritis. It is 3 times more likely that a woman will get arthritis than a man. It is also more common to get osteoarthritis when someone is over the age of 45. There is no known cure for this condition, but there are ways to decrease the pain. One way is weight control. Without the extra weight pushing on the joints, the pain will decrease and the joint will not be as inflamed. Another way is taking medicine. There are many types of medicine people can take to help reduce the pain and reduce the inflammation of the joint. Exercise is also a good way to control arthritis. Since arthritis makes the joints stiff, exercise helps move them around and strengthens the muscles. By doing that, it reduces the stiffness and improves flexibility. The second type of arthritis I will talk about today is rheumatoid arthritis. This is also an inflammatory condition, but also considered an autoimmune disorder. This condition occurs when the immune system attacks the body's tissues. This can also sometimes affect other parts of the body like the skin, eyes, and lungs. The diagnosis for this condition is very tricky because there is no one test that can say if someone has rheumatoid arthritis. Doctors can tell because of the symptoms people are having. This type of arthritis is also very common, with 1% of the whole world population having it. Rheumatoid arthritis affects the lining of small joints, for example in the hands, wrists, and feet, causing painful swelling and stiffness. It can also cause joint deformity in the body part that is affected. The most common body part that people get rheumatoid arthritis in are the hands. Some symptoms of this condition are fever, loss of appetite, chest pain, tender swollen joints, and firm bumps on the body part affected. As you can see, rheumatoid arthritis has a lot more severe symptoms than osteoarthritis. This is very unfortunate since there are about 1.3 million Americans affected by it. The risk factors of rheumatoid arthritis are family history, age, and gender. If there has been anybody in your family history that has had rheumatoid arthritis, you're more likely to get it than someone that does not have anyone in their family history with it. This is also more common in women than in men. If you are 50 years or older, then it is also a risk factor of getting rheumatoid arthritis. There are no known treatments or cures for this kind of arthritis, but there are some things people can do to decrease pain and slow down the progression of it. Medication can help with the pain and the inflammation. There are specific medicine out there that are anti-inflammatory, which can help a lot with arthritis. Physical therapy is also a way to make the symptoms better. A physical therapist can help work out stiffness with exercises without damaging the joint. No treatment can stop the progression of rheumatoid arthritis, but it can for sure slow it down, which is the goal for people with this condition. In conclusion, arthritis is a very common medical condition that affects many people around the world today. This disease is not very preventable because some of the risk factors are family history, age, and gender, which people can't control. Unfortunately, there is no known cure for this disease, and the only thing people can do is try to decrease the symptoms like swelling and inflammation. There is no way to stop the progression of arthritis. The only thing to do is try to slow down the progression. Hopefully in the future, there are treatments that can cure all types of arthritis so people can live without the pain and inflammation in their joints. Thank you for listening and have a great day.